Welcome to part 1 of this concise video log on COVID-19 vaccine considerations for an aging person with HIV. This program is provided by Clinical Care Options and is supported by independent educational grants from Gilead Sciences, Merck Sharp and Dome Corp, and ViiV Healthcare. This vlog was recorded by Dr. Rajesh Gandhi. Before we begin, please note his disclosures on this slide. This vlog is part of a comprehensive educational program on caring for aging patients with HIV. You can gain CME, CE, or CPE credit for viewing these vlogs and download the slides by visiting our website, clinicaloptions.com.
Hello, I'm Dr. Raj Gandhi from Massachusetts General Hospital and Harvard Medical School. I just saw a patient with HIV who wanted to discuss COVID-19 vaccination. So in part 1 of this 2-part video log, I'm going to talk about the details of this patient and how I counseled him on what we know about COVID-19 risk in people with HIV. So let's talk about this patient's background. He's a 60-year-old man. He has hypertension and hyperlipidemia. He's been on antiretroviral therapy for 10 years. His CD4 cell count prior to starting therapy was 100. He's currently receiving dolutegravir plus FTC TAF. He works with customers as a bank teller, so has a number of COVID exposures. His CD4 cell count is 300. His viral load is undetectable. He's overweight with a body mass index of 28. His CBC and metabolic panel are normal, and his co-medications include lisinopril and atorvastatin. So there's a number of key issues in thinking about COVID-19 in this particular patient. We know from the very beginning of COVID-19 that age is an important risk factor for severe COVID-19. And that's why after the phase 1A of the COVID-19 vaccinations, that is for people who are healthcare workers or people who work or live in a congregate setting in a skilled nursing facility, the CDC will recommend that persons over the age of 65, as well as persons who are 64 years of age and younger with high-risk medical conditions, will be recommended for vaccine distribution. So are people with HIV at higher risk for severe COVID-19 outcomes? And should a patient like mine, who's a person with HIV less than 65 years of age, be vaccinated in phase 1C? So here are the risk factors for severe COVID-19. The known risk factors are things like older age, comorbidities such as cancer, cardiovascular disease, chronic kidney disease, COPD, sickle cell disease, and type 2 diabetes, immunocompromised state due to solid organ transplant, obesity with a BMI of 30 or more, pregnancy, and smoking. The CDC lists the factors on the right-hand side of the slide as potential risk factors. That is, they may be risk factors for severe COVID-19. So this is where comorbidities such as asthma, cerebrovascular disease, hypertension, liver disease, a variety of neurologic conditions such as dementia, and type 1 diabetes are fitting. Other immunocompromised states, including HIV, are considered potential or possible risk factors for severe COVID-19. And then being overweight, having a BMI of greater than 25 and less than 30 is considered a potential risk factor for severe COVID. So what are some potential reasons why people with HIV may have worse COVID-19 outcomes? So there's 3 main categories or 3 main theories as to why people with HIV might have worse outcomes. One is immunodeficiency or perhaps immune dysregulation. The second is comorbidities, and the third is the social determinants of health. So let's talk about these in a bit more detail. So we know that people with immunodeficiency, such as organ transplant recipients, are at increased risk for severe COVID-19. And we also know that prolonged SARS-CoV-2 replication has been seen in people who are immunocompromised. Some of these individuals who are severely immunocompromised will have SARS-CoV-2 replication for weeks or even months. These data suggest that people with HIV who have low CD4 cell counts who are immunodeficient may be at increased risk for severe COVID-19, as they are for severe complications of influenza. In addition to immunodeficiency, we've known for some time that people with HIV on antiretroviral therapy have residual inflammation. This residual inflammation is most pronounced in people with HIV who have a low CD4 cell count nadir, like my patient, patients who have incomplete CD4 cell reconstitution, also like my patient, or those who have a CD4 to CD8 ratio that's quite low. It's thought that perhaps this immune dysregulation legacy effect could affect COVID-19 outcomes, but that's not yet been proven and is something that studies are looking into. The second main reason why people with HIV might have more severe outcomes are comorbidities. We know that people with HIV have high risk of comorbidities, and we'll look at some of those data shortly. And finally, and perhaps very importantly, are social determinants of health. People with HIV are more likely to be racial and ethnic minorities and to be poor, and we know that these are strong risk factors for poor COVID-19 outcomes. So here are some data showing that comorbidities are increasingly common as people with HIV age. This is a national survey of people with HIV over the age of 50 in the United Kingdom. Almost all of these people are virologically suppressed. And you could see that in the graphic on the right, that comorbidities are frequent. And in particular, as people age, multiple comorbidities are incredibly common. More than 50% of people with HIV had one or more comorbidity. And as one gets older, many people have multiple comorbidities. Here are some data from Mass General Hospital, where I work, that looked at a case series of people with HIV and COVID-19. This was a cohort study that was done between March and April 2020. It included 36 people with HIV who had confirmed COVID-19 and 11 people with HIV who had probable infection. The take-home point from this particular study is that 83% of our patients with HIV who had COVID had a non-HIV comorbidity that was associated with severe COVID-19 outcomes, things like obesity, cardiovascular disease, etc. Another important point of this case series is that 80% of our patients with HIV and COVID were Black or Hispanic Latinx, and about half of them had exposure to a congregate setting. Either they lived in a congregate setting or they worked in a skilled nursing facility. So is HIV a risk factor for worse COVID-19 outcomes? We've talked a little bit about why HIV may worsen outcomes, but there have also been some proposals that HIV may not worsen outcomes and may even be protective. For example, it's been postulated that immunologic factors or maybe antiretroviral therapy itself may have a protective effect. Now, I'll hasten to say here that there's no evidence yet really that these are protective, and I do counsel my patients that I do not think that their antiretroviral therapy or having HIV is any way protective against worse outcomes. But let's examine some of the studies that have shown that HIV is not a risk factor for worse outcomes. This table shows a variety of studies that have really shown no link between HIV and worse COVID-19 outcomes. Several of these studies are from New York City from the early days of the pandemic, and those studies really did not show an impact of having HIV and having worse outcomes. Let's examine one of the larger studies. This was a multi-center study that was from multiple places around the United States, not just from New York City. So this particular study looked at outcomes in a little over 400 people with HIV who had COVID-19. And they compared those outcomes with a propensity-matched cohort of patients without HIV. And this was a large number. This was close to 50,000. Interestingly, in an unmatched analysis, the mortality was actually higher for people with HIV. But then when they did one-to-one matching on a number of factors that are associated with worse COVID-19 outcomes shown on this slide, then mortality was no longer any different between those who did and did not have HIV. And you see that in the graphic on the right, really no difference in terms of survival between the people with HIV and the people without. So this particular study would imply that it's the comorbidities that are driving outcomes in people with HIV. A similar study that gave a similar lesson, it comes out of the Veterans Aging Cohort Study, or the VAX. This looked at COVID-19 testing and outcomes in people with HIV versus persons without HIV, all within the VA cohort. Here they had about 250 people with HIV and COVID, and they had about 500 people with COVID who did not have HIV. If you look at the table on the right-hand part of the screen, you'll see that in many of the important outcomes, hospitalization, ICU admission, intubation, and death, the people with HIV and the people without HIV really had similar outcomes. So these two studies, the ones we've examined here, are reassuring that people with HIV have similar outcomes to people without HIV. But somewhat more recent data is not so sanguine and not so reassuring. There are data now that are emerging suggesting that HIV may be a risk factor, although the reason for that is not yet totally certain. So here are several studies that I want to highlight that demonstrate now an association between HIV and worse COVID-19 outcomes. The first of these comes from the New York City Health Department. This looked at about 2,400 people with HIV and COVID and over 200,000 people who did not have HIV but had COVID. And in this particular large study, there was an increased mortality among people who had HIV and COVID as compared to those who did not. Now, a very important point to make here is that this particular study was not able to adjust for some of those important comorbidities that we've been talking about. A second study, this time from New York State, also showed an increased mortality. This was able to adjust for some comorbidities, but it's hard to say if they were able to adjust for all of the comorbidities. A study out of the UK suggested an increased mortality, but again, it's hard to say with certainty whether all the comorbidities were adjusted for. And finally, a study also from the UK, but this time really just in hospitalized patients, suggested an increase in mortality. Now, let me show you some data from South Africa, which is one of the largest studies on this particular topic. So this particular study was done in the Western Cape of South Africa. It looked at public sector data. It involved 22,000 individuals, including about 4,000 people with HIV, all of whom had COVID-19. In this particular study from South Africa, the mortality ratio for COVID-19 death was over twofold greater if a person had HIV as compared to if they did not have HIV. Now, like several of the studies that we've already touched on, this particular study could not control for all of the things that could impact COVID-19 outcomes, and in particular, was not able to control for social determinants of care, nor could it control for obesity. Let's examine what factors among people with HIV might actually be operative in terms of affecting survival. So this particular study is just among people with HIV. It involves a little over 285 people with HIV and COVID. It's a multi-center study with data collected from around the United States. It was put together by investigators in Missouri. Most of these people with HIV were on antiretroviral therapy. Most were virologically suppressed. Some of the risk factors for worse outcome are the things we would expect: older age, chronic lung disease, hypertension. But an important factor was also discovered in this study, which was lower CD4 cell counts among people with HIV was associated with decreased survival. And if you'll think back to that immunodeficiency idea, or even immune dysregulation idea, these data are pointing in that direction. A separate analysis of European cohorts of people with HIV have also shown that CD4 cell counts of less than 350 are associated with increased risk for severe COVID-19 outcomes. So that study from Europe is very much similar to what we're seeing here in the United States. So where are we now with the understanding of how HIV impacts COVID-19 outcomes? How should we counsel our patients? So right now, some studies, but not all, have suggested that people with HIV have worse COVID-19 outcomes. But it's not yet certain if HIV is a risk factor for worse outcomes independent of comorbidities and socioeconomic factors. What we really need are studies of HIV and COVID-19 outcomes that adequately account for immunologic function, comorbidities, and socioeconomic disparities. That is, we need to disentangle the effect of HIV itself from comorbidities and socioeconomic disparities. But while we await these critical studies, I think there are several reasons to prioritize people with HIV for COVID-19 vaccination. We know that there are high rates of comorbidities in people with HIV, and some of these occur at an even earlier age than in people without HIV, and they may not always be diagnosed. A second reason to prioritize people with HIV is that social inequities may make COVID-19 prevention, such as social distancing and working remotely, more difficult for many of our patients living with HIV. So let's return to our case. This is a 60-year-old man with HIV, well controlled. He has hypertension, hyperlipidemia. He's overweight, so he has several risk factors that put him at potential risk for severe COVID-19 outcomes. He also has a number of COVID-19 exposures. He works as a bank teller and has daily contact with customers. He has a low CD4 cell count nadir. His CD4 cell count nadir was as low as 100. And he has incomplete CD4 cell reconstitution. His CD4 cell count is 300 despite many years of successful antiretroviral therapy. So he may have that immune dysregulation legacy effect that I touched on. Not a proven risk factor, but something to take into account. So what I would do is I would recommend COVID-19 vaccination as soon as it is available. And if you're interested in the data on COVID-19 vaccination in people with HIV, as well as in people who are older, such as my patient, as well as how I counseled him, please log in to part 2 of this video log. Thank you, and I appreciate your attention.